India has recorded 335 fresh COVID-19 cases and 5 deaths today. 4 of those deaths have been reported from Kerala and 1 from Uttar Pradesh. Question is, as cases surge around the world, should you be worried? I'm putting that question to Dr. Isaac Bogoch, who's an infectious disease physician and scientist joining us from London this evening. Dr. Isaac, thank you very much for your time here on Mirror Now. First things first, we have one case in Kerala, a South Indian state, where the new variant has been detected. The woman who was infected was an elderly lady. She has since recovered. I want to ask you if there is anything for us here in India and the rest of the world to be worried about. More importantly, should we be masking up?
That's a great question. I think let's take a step back and remember that the JN.1 is under the umbrella of Omicron, and we've been in the Omicron era for almost 2 years now. Of course, we know this virus will continue to mutate, continue to change as it's doing, as expected. JN.1 is, one of the mutations, and of course, this is one of the sublineages of Omicron that's taking off. The reason people are getting sick is because it evades some of the immunity that we have gotten from either vaccination or recovery from infection. And of course, when you detect it in one part of the world, because there's such tremendous human mobility right now around the world, the travel levels are back to pre-COVID levels. When you detect it in one part of the world, you know it's in many other parts of the world. So it's very likely to be widespread and detected in many, many parts of the world. And to your question, very important question, of course, there's steps that we can do to reduce the risk of COVID-19, and it also reduces the risk of other infections transmitted primarily through the air, like respiratory syncytial virus or the flu. You can put on a mask in an indoor setting where you'll reduce the risk of infection. Obviously, we have COVID-19 vaccines that are helpful. They reduce the risk of infection a little bit, not as much as they used to, but they do a little bit. They really help reduce the risk of more severe manifestations of the virus, like hospitalization and death. And of course, we can improve the quality of the air in indoor settings to help reduce more distance spread in indoor settings.
Okay, Dr. Isaac, can I ask you this then? What we are seeing, we are seeing a slight surge here in India, but 335 cases really aren't that much. Across the world, is the surge showing an increase where the world should be worried? And the new subvariant that we are talking about, is this the one that was making children sick in China? And what is the situation there?
Yeah, a couple of great questions. So yeah, this particular one, this JN.1, is growing in many parts of the world. And, when we look at the case counts, it's very hard to interpret only that bit of data. I think we need to look at more holistic data, not just cases, but obviously hospitalizations, deaths, percentage of tests that are positive, wastewater surveillance. We should look at broad data to help paint the picture. But it's clear that COVID is on the rise in many parts of the world, including in many Northern Hemisphere locations. As is expected during the winter time in the Northern Hemisphere. And, of course, it's going to cause illness. And sadly, it's going to cause death. And again, we can take steps to protect ourselves and protect those around us. Now, China was, interesting because China had people will define this in different ways. I'm going to say pretty heavy-handed COVID control measures that were lifted later than most countries. And they saw a significant resurgence in illness in children following that. I'm in Canada right now. Canada had the same issue after we lifted our COVID measures. We had a very big year of RSV and influenza. In China, they had their officials reporting RSV, influenza, COVID, and a bacterial infection called mycoplasma as well that's known to cause pneumonias. So, it might be related to them lifting those very significant COVID measures and having a lot of people exposed to a lot of infections for the first time, which can, certainly overwhelm hospitals and healthcare systems. Obviously, it doesn't matter what part of the world people are in. We wish everyone well, and we hope to prevent these infections regardless of what part of the planet people are on.